Welcome. My name is Mary Doyle, and I'm a senior research associate in the Department of Environmental Health Sciences at the Johns Hopkins Bloomberg School of Public Health. I direct the continuing education and outreach programs in the NIOSH-sponsored Johns Hopkins Education and Research Center for Occupational Safety and Health. I'm a nurse by training, and I'm certified in occupational health nursing and case management. Today, we're going to talk about vulnerable worker populations. Who are they? These are some of the learning objectives that I will be covering today in this lecture. It's important for us to understand the issues of vulnerable workers and how that is impacted by circumstance or intervention. We will talk about how many vulnerable workers we have in this country, the characteristics of this desperate population, and we'll end with some actual case studies of vulnerable workers to demonstrate why this population needs protection and intervention to assist them in reaching their full potential. This quote describes the interaction between individuals or communities and the resources they have and the challenges they face. During our discussion, you will see that people face a myriad of challenges, and each may handle them differently. This is due to human variability, which allows for a wide range of characteristics based on genetics, the environment, and cultural factors. The resources available to an individual also plays a significant part in their vulnerability. Think of this as a math equation. Vulnerability equals life challenges minus resources. If you take away resources or increase the life challenges the person would face, this would increase their vulnerability. Conversely, if someone has a great deal of resources, it would lessen their vulnerability because the life challenges would decrease. Who are vulnerable workers? We can think of a number of individuals or groups who may be vulnerable based on the environment in which they work or the challenges they face. The salon worker who is handling a myriad of chemical products to treat hair, the blind or hard of hearing worker, someone with a chronic medical condition, young, migrant, or cognitively impaired workers. You can see here that there are a large number of vulnerable worker populations. The physical and mental benefits of work have been well documented in the medical literature, and vulnerable workers have every right to enjoy those benefits along with the rest of their colleagues in the working population. There are several components of vulnerability. We can divide vulnerabilities into three domains: the physical, psychological, and social. One may have vulnerabilities in more than one area, which would compound the vulnerability and make it more challenging to meet their needs in the workplace. Also, we know that vulnerabilities can change over time. If we look back at our equation, the resources may increase or decrease, as well as the challenges that the person faces. Medical intervention may alleviate or mitigate a medical condition or a psychiatric disorder, thus reducing the challenges faced by that individual. Social services may improve the person's living or economic situation. Changes in societal attitudes and laws, such as those to protect the LGBTQ community, are shown to reduce vulnerability. Depending on the political climate, we see priorities change and resources increase or decrease, depending on their agenda. But we still have a long way to go to protect our most vulnerable members of society. Let's explore physical vulnerability in more depth. I have listed some causes of physical vulnerability. These are just a few examples, and there are many other causes of physical vulnerability. A wide variety of physical vulnerabilities occur as a result of various medical illnesses and injuries. These may occur on or off the job or previous to entering the workforce. Congenital conditions are present from birth. They may be genetic, that is, inherited for one or both parents, from a physical anomaly that occurred during the pregnancy, such as spina bifida, from a viral or bacterial infection during pregnancy, or from a birth injury during delivery. For example, hearing impairment may be inherited from a parent or caused by an infectious disease the mother was exposed to, like the 1960s rubella epidemic in the U.S. that affected 12.5 million people. 11 million pregnant women lost their babies, 2,100 newborns died, and 20,000 babies were born with congenital rubella syndrome, which can cause deafness, vision problems, and cardiac issues. With the advent of the measles, mumps, and rubella, or MMR vaccine, as part of the infant vaccine schedule in the U.S., very few cases now occur. Those that do can usually be linked to exposure outside the U.S. while traveling or in an area where vaccines are declined. Infectious disease can cause a wide variety of disability depending on the infectious agent, the area infected, and the health of the host. Viruses and bacteria can both seriously impact health. Meningococcal disease is usually thought of as a young person's disease, especially college age, but we see it in people who have certain medical conditions, take specific medications, or travel to other parts of the world, such as sub-Saharan Africa. Viruses such as HIV and the SARS-CoV-2 virus have caused great concern in the workplace. We have learned much about both diseases and how to protect the vulnerable worker with these conditions, as well as their colleagues in the workplace. Chronic disease can be visible or invisible. We may see our coworker lose their hair when they undergo chemotherapy, or have a pronounced limp or hemiplegia after a stroke. Other diseases like lupus, Crohn's disease, celiac, and type 1 diabetes are invisible, in that you would not know the person was affected in most cases unless they told you. Disability from injuries on and off the job are a huge problem in the U.S. There are 2.8 million non-fatal accidents and injuries in the U.S. in 2019 from the Bureau of Labor Standards data. There were 4,764 fatal injuries in 2020. Young and lower educated and lower socioeconomic workers tend to have riskier jobs, thus increasing their risk for injury and disability. So that is why we consider them vulnerable workers. I like this quote from Zubin and Spring regarding psychological vulnerability. Some workers may be predisposed to psychological problems for a variety of reasons. This makes them vulnerable to a psychological disorder when encountering stressful experiences on or off the job. The inability to adapt due to their psychological vulnerability can cause a psychological disorder. Many workplaces provide employee assistance programs to help their employees through short-term psychological problems and life stressors. More involved issues would require referral to other mental health providers for long-term therapy or medication. Providers can be psychiatric nurse practitioners, psychologists, mental health therapists, or psychiatrists. Some examples that might cause psychological vulnerability are stress, abuse, high-demand jobs, divorce, death, loss of a parent as a child, which can cause cognitive bias, thus predisposing one to psychological problems after experiencing stressful experiences such as injury on the job of yourself or others. Systemic racism is an additional barrier to psychological well-being. This refers to discrimination in all areas of our society: educational system, healthcare, economic, housing, employment, etc., which affects the opportunities, the resources, and the well-being of those who are being discriminated against. According to Dr. Timothy Clark, the author of 4 Stages of Psychological Safety, Defining the Path to Inclusion and Innovation, employees have to progress through 4 stages before they feel free to make valuable contributions and challenge the status quo. So as employers, we need to make sure that our employees can work through these stages in order to make their maximum contribution. Stage 1 is inclusion safety. They feel safe to be themselves and they're accepted for who they are. Stage 2, they feel safe learning and making mistakes. So when they make a suggestion, they're not shot down by their colleagues or their boss. It's a safe environment. Stage 3 is contributor safety. They feel safe to use their skills and abilities to make a meaningful contribution. And Stage 4 is challenger safety. They can speak up and challenge the status quo. So you'll find the best employers are the ones that want to hear from their employees, and all comments are accepted and considered. We use red flags as a warning sign in the case management of ill and injured workers in the occupational health arena. Mental health red flags are important to recognize in identifying those who may be vulnerable and more susceptible to illness and injury. Workers with chronic disease have a large burden. They may miss work due to illness or from frequent need for medical evaluation and care. This may cause them to use their sick leave and/or vacation time, if they even have it, or take leave without pay in order to seek medical care. Workers may be fired from their jobs if they take too much time off. Chronic illness often requires prescription medication, lab work, medical procedures which add a financial burden to the patient. If eligible, FMLA or Family Medical Leave Act may protect workers' jobs. Social vulnerability increases human suffering and economic loss, according to the CDC and ATSDR. They have developed the Vulnerability Index using 15 census variables. This helps officials identify vulnerable communities after disasters. And so they look at such factors such as age, the family situation, are they immigrants, are they refugees, what the educational status is, their economic status, are they living in poverty? Do they have housing security? What's the location of the house? Is there access to transportation? Do they have any chronic illnesses or comorbidities? Are the LGBTQ community? They may be socially and psychologically vulnerable as a result of being in this community. Are they exposed to natural or man-made disasters? Again, they can use this index to come up with a score to identify vulnerable communities after disasters so they know where to best put their resources. And this is, again, a slide that shows some of the different factors that they look at according to socioeconomic status, the household characteristics, racial and ethnic minority status, and the housing types. And again, the more factors that they have in this right-hand column, the higher the risk of vulnerability will be. Vulnerable work is precarious. It's defined by the 3 Ds: dirty, dangerous, and demeaning. It's often work that nobody else wants to do. Non-standard work means not full-time or part-time work. It's either temporary work or temporary employment. It's gig work, which are short jobs from various employers. However, up to 17% of workers have either no direct employer, an intermediary employer, or a temporary or on-call relationship to employment. Non-standard work has shifted over time, with some growing and some declining, but overall it appears to be growing. This suggests that a large portion of the U.S. workforce may be excluded from the protections of labor laws and public social insurance systems. Some more characteristics of vulnerable work: they're informal hours. They may change every day. They're very long hours, can up 12, 18 hours a day. Many of these workers are working more than one job. I often had workers in my occupational health setting that would come in and work night shift, and they'd go directly to a day job and only sleep for a couple hours in the evening before starting all over again. It's often temporary work, so they'd work for several weeks, and then the job would end, and they'd have to find another job. They often work for smaller companies that don't have the benefits and the support that larger companies do. These workers lack education and skills to get a better paying job. Their pay is low. It's less than the median wage in the area. And they lack insurance, health insurance, workers' compensation, and any benefits that would come out of a more regular job. They lack Social Security and other benefits that compel them to work when they're sick. They don't get sick leave. So this is what we saw in the COVID epidemic. Many of these workers came to work when they were sick anyway, thus perpetuating the epidemic. These people have no voice representing them, so no union representative or other representation. They're poor working conditions. There's a higher rate of workplace fatalities because it's hazardous work. And many of these workers are immigrants or refugees, and they're subject to human trafficking, abuse, and violence. There's been a great burden shifted from the institution to the worker over the past 25 years. We have some regulated and unregulated occupational exposures. So we have lead and noise, things like that, that are regulated by the government. But we have many exposures in the occupational health setting that are not regulated, like workplace violence and heat. Some small businesses are not subject to OSHA regulations, depending on their size. Education and training is not usually paid for by the employer, so that is up to the individual to seek out those opportunities. Retirement is often the responsibility of the employee now. There's a great inequity between low and high-wage workers, where we're seeing the CEO receive a golden parachute when they retire, and the employees, when they're laid off, getting little to nothing in the way of compensation. So the scope of the problem of vulnerable work. According to the Brookings Institute, 90% of U.S. jobs were vulnerable in 2018. We had 26.3 million U.S. immigrant workers in 2015, which comprised 16.7% of the total workforce. Of those, 48.8% were Hispanic and 24.1% were Asian. By 2060, it's estimated that the immigrant workforce in the U.S. will be twice the native-born workforce, and the highest growth is expected to be among Hispanic workers. The COVID-19 pandemic highlighted a special set of vulnerable workers, and that is the frontline workers. The Brookings Institute identified 50 million people who qualify as frontline workers. Only 90 million total people are employed in America's essential industries. So we had the healthcare workers, the food service and agricultural workers, public sector workers such as the trash, public health workers. These were the frontline workers who had to go to work every day during the pandemic. Obviously, they couldn't work at home, so they were the frontline workers who were most vulnerable.